Hey guys, welcome to OurGoingSimpleXNursing.com. In today's video, we'll be talking on essential medicine, also known as essential drugs. Now, talking on essential drug lists was first established by WHO in the year 1977, and it was established in order to serve the priority health needs of the population. So, according to the definition that was stated, it said essential drugs are those drugs that satisfy priority health needs of the population. That means these drugs were made available due to their ability to satisfy the needs of the population. That's the healthcare need of the major population at that time. That's as at 1977. And this drug comprised of over 385 drugs that are used then. So those drugs were selected due to several factors, which include one, the public health relevance, evidence of efficacy and safety, and comparative cost reduction. That is, these drugs were selected due to what? Public health relevance. That's how relevant is this drug to the public? How relevant is this drug in order to serve their healthcare need for those drugs? Then the evidence of efficacy and safety was due to the ability of the drug, of those selected drugs, to serve the purpose which they are being prescribed for, that is to provide, to promote the health of those that are receiving the drug, and to make sure that those drugs are safe for those that receive it. That doesn't cause harm, that is cause little or no harm to those that receive the drug. Then the next was comparative cost reduction. The next is comparative cost reduction, and the purpose of selecting the drug was for the purpose of reducing the cost of the drug. That is to say that these drugs are cheap and they are readily available for the population. So this one thing you should know is that this essential drug are meant to be always available in sufficient quantity at various healthcare delivery centers in order to make use of them when necessary. So the next now is benefits of adoption of the essential drug policy or essential drug concept. Talking on the benefit of adoption of the essential drug concept or essential drug policy, one of the benefits is to ensure availability of the drug. That means to make sure that those drugs are readily available at various health centers or health facilities in order to meet their healthcare need. Then the next was cost saving. That is helped to save costs. That's the cost of purchasing those drugs over the counters or in other pharmaceutical stores. These drugs were made available and are still made available in various health facilities, and it is provided at a cheaper cost. That's why it's one of the benefits is what? Cost saving. Right, the next now is rational drug use. Talking on rational drug use, this essential drug list help in ensuring that drugs are used appropriately. That's in the way they are supposed to be used, and well managed to avoid the misuse of drug. So these are some of the things which we'll talk about on essential drug. And the next we'll talk about now is what? Prescription drug and the non-prescription drug. Now, when we say non-prescription drug refers to those drugs that are only given out to patients on prescription. So from what we have on the board, we say that prescription drugs are sold to patients only on prescription from a registered medical practitioner. So these drugs are given to patients because it has been prescribed by a medical practitioner. That's a registered medical practitioner, and that's why it can be prescribed, can be sold to them. And this drug can be found over the counter because they are only sold on prescription to patients. Then the next now is non-prescription drug. Talking on the non-prescription drug, one example of the non-prescription drug is, another name for non-prescription drug is what? OTC, that is over-the-counter drug. And these drugs sold over the counter, they are sold to patients on demand. That means when the patient needs them, you can go over the counter and get them because they are less harmful. But this prescription drug, they are considered to be harmful to the patients when misused, unlike the non-prescription drug, which are less harmful to the patient. So example of some of these non-prescription drugs include simple analgesics such as the paracetamol, aspirin, then some other drugs like vitamins and laxative. These drugs do not cause much harm to the patients when taken a larger dose or when abused, so they are grouped under this non-prescription medication. Do well to please make sure you subscribe to the channel to be notified whenever a new video is being released, and please share with your friends and your colleagues. Thank you very much for watching.